Hello, and thank you for investing the time to learn about an innovative platform that really enables you, the agent, to serve more clients. This is cutting edge. It's a technology that can help revolutionize your business. It'll put a lot of manual work, it'll put on autopilot and simplifies the overall Medicare sales process. As an agent, think about where you spend your time. There's only so much of it in a day, and you spend a majority of your time helping others. This is especially true during this year's unique and unprecedented AEP. You're pulled in all sorts of directions while working to really maximize opportunities before AEP even comes to a close or kicks off. There's so much to prepare for and maybe things to brush up on. Think about understanding network plans and how to figure out the preferences of your clients, of meeting and gathering scope of appointments and comparing plans, which brings us to a crucial question. How can you spend more time on what matters most and less time on the busy work? Our new MedicareCENTER sales and marketing platform can make a huge difference, and it's completely free for you to use and gain access to just for working with us. That's right. We have heavily invested in this technology to really enable you, the producer, and to help you be more successful. And it comes back in the end to helping serve more Americans. Essentially, the new MedicareCENTER is built to help agents just like yourself. Now, we're talking about a complete sales center. MedicareCENTER, inside of it, has a client management tool. Think of a CRM or a digital Rolodex. Turn all those files and folders of your clients and their profiles, turn those into digital profiles that you and or your staff can keep track of year to year, month to month, appointment to appointment. We also have a Medicare supplement quoting tool, a Medicare supplement comparison tool, anything you need to get Medicare supplements in front of more clients. Then we also have an MA and a PDP enrollment tool. And we can take the best of the industry tools, put those in your hands through MedicareCENTER. And we even have two of them, and we're going to talk about those today. You know, we surveyed over 500 top producers from across the country, and we were able to really unlock and notify and see and kind of filter out some key ingredients to successful Medicare selling. When you think about it, those are the things that are absolutely pivotal to success in being a top producer. With MedicareCENTER, you can compliantly, keyword, manage clients. You can compliantly compare plans, get quotes, electronically enroll clients, and a lot more we're going to talk about, all from one convenient and one efficient platform. So I want to dig a little bit deeper and talk about the details of all that goes into MedicareCENTER. This is a relationship business, and MedicareCENTER puts managing the client relationship on autopilot. What I mean by that is you can simply manage, you can track clients, you can do it all digitally, regardless of whatever enrollment system you're using. You can create a new client profile. Just all you need is an email address or their phone number, and you can get it stored in this simplified CRM. You can also, think about it, stay HIPAA compliant. Get rid of those old manila folders at the office, in the drawers, maybe in the trunk of your car in some different bins. But also, clients are more comfortable and they're more tech savvy than they've ever been before. It's time to go digital with your client list. And we want to put the tools in your hands. Think about how many carriers and plans you're going to need access to each and every appointment. The certification process is really a great reminder of that. You know, you're ready to sell with all those carriers. But do you know all the usernames and the passwords to each and every one of those carrier websites and agent portals? Get rid of those sticky notes stuck to your laptop or maybe laying around your desk. MedicareCENTER has the ability to access all the quoting and enrollment platforms you need using an all-in-one universal login. One username, one password, one site for everything. It's all in one place. You can also easily reset your password and manage your admin communication right there. All you got to do is register and link your accounts. Who doesn't know their NPN and who can't set one password? We made this simple. We also, think about it, we have the best marketers in the industry. They're the lifeline when you need to pick up the phone and speak with someone, whether you're preparing or maybe in the middle of an appointment. But you might also like to tap into our learning center that's inside of Medicare Center. This is where you can get tips and learn about industry best practices on the fly, on the go. You can access guides, you can download support materials that can get you the most out of Medicare Center and all the learning and all the IQs at our office. We want to put it in your hands so you can access it 24/7. You can even watch digestible short videos, download the material, and of course, you can get the latest product information and insights regarding all the carrier updates and the market news within Medicare Center's Learning Center. Let's talk enrollment platforms. This is crucial. We're not bringing you just one, we're bringing you two e-enrollment platforms, the top resources in the industry we've invested in, and we want to enable you for AEP and really for MA and PDP. Each of these has some powerful features and benefits, and you can really work with your marketer to decide the best fit. But if you want to compare them side by side, Medicare App and Medicare Link break down like this. If you have previously used Medicare Center with us before, all of your 2020 client data is going to be stored and saved within Medicare App. Medicare Link is brand spanking new. Now, carriers available. That's really the next step to think about. Which plans do you need access to? Medicare App and Medicare Link, they have different amounts of plans, but work with your marketer on the most up-to-date list of those carriers that are available and see which tool best fits for you based on plans that you need access to. And then texting scope of appointments. It's a big feature. This is huge, definitely for this market environment and landscape. Both tools you can text, and we're talking text message, text a scope of appointment, the client can sign it, accept it all. What about signing paperwork? If someone, even belly doesn't want to fill out some forms and they have a smartphone, you can text signatures. We're talking text to enroll features for both of these e-enrollment tools. Both tools also store their prescription drug list, and both tools also create personal shopping links, also called pearls, where you can create the link, send it out to them via email, and they can take care of the shopping all right there with those personal shopping links. And then a little bit of differentiation. When it comes down to Medicare App, they bring what's called the blue button technology to the table. This is where the client can sync up their prescription drug list with Medicare.gov if their prescriptions are there. Great tool, great features. Now, Medicare Link brings a new feature to the table, what's called the Shop by Doc. You can specifically pull up a doctor and see what plans those doctors take. So overall, you can see both plans do a lot of the same things, a lot of crossover, but work with your marketer here at the office to make sure which of these best fits your business model right now, today, and in the future. Now, this is a relationship business, and Medicare Center puts managing the client relationship, it puts it on autopilot. What this means is that we want to get into the meat and look at how your relationships can be maintained and you can fully function no matter the preference for how someone wants to meet in person or over the phone. The first tool we want to look at is Medicare App. If you're one of the thousands of agents who have used or are currently using Medicare Center, you'll feel right at home with some new enhancements and some features with a new look. With Medicare App, you can shop, you can quote, you can enroll all electronically, any device. This platform, this tool gives you access to an extensive list of carriers and lets you estimate the cost using kind of a guided help and a guided process to walk through for each and every client. What really stands out about Medicare App is how it helps you provide the most accurate prescription drug cost. You can deliver pricing based on local pharmacy pricing instead of the regional averages, and you can look at savings for drugs. All of this really and truly helps ensure that your clients can see a reliable and a realistic out-of-pocket estimates. You know how important that is. Once clients have accurate costs, they're going to feel more confident. You're going to be more their trusted advisor, and it's going to help them get the best plan, and you provide the best service, and in the end, help more Americans. Medicare app's electronic signature feature is pretty darn cool, and it's also allows you to engage your clients no matter which way they prefer. You can still email, but you can text, and you can do that for executing the documents, signing, and that can also apply to the scope of appointment. So we're talking the applications and the scope of appointment can all be done via electronic signatures with simply sending a text message from the portal. Now, Medicare app also brings what's called blue button technology to the table. The blue button feature is going to help clients build out their medicine cabinet quickly, easily. It's going to sync that up using simply their email address and pulling in that data from mymedicare.gov. These prescriptions are added automatically. There's no typing, there's no entering, there's no misspelling of words, of prescription titles. You can be confident that this is going to be a more error-free process because it always stays current. It's always syncing. Now, what most individuals and most marketing companies and IMOs would bring you one option, but we have invested heavily into a second enrollment tool because we understand how things work, and we want to bring you another industry-leading e-enrollment, really a pathway or a road, and it's called Medicare Link. So let's dig into Medicare Link. This is going to let you search plans by doctor or physician. You can compare coverage options to your client's current plans. You can also sign the scope of appointments and applications via text message. Yes, I said text message. This is fully digital process if you need it to be. Or you can email the documents. You can have the paper documents and scan them and still send them over. But you can enroll clients electronically from whatever device works for you. But also, if you're in the middle of a process or just getting started and you pause, Medicare Link has a great, really kind of like a bookmark feature that lets you pick right up where clients left off previously. And this is incredibly helpful. The dashboards are all focused on the progress, how far along clients are, what type of disposition they're in, and all the reports are really user-friendly, and the information is easy to find, navigate, and search out. Many agents have expressed excitement about how simple Medicare Link is to use. You can quickly quote, follow up, the navigation is fully, you can quickly quote, you can follow up, and you can really kick off an enrollment based on the client's needs, wherever and whenever you and your client may be located. In this platform, the reporting tools, the performance tracking, we're seeing that 10 minutes is the average time to get a process completed. You can't really beat that. So let's think about this. We have the biggest open enrollment some of us may ever have seen or experienced. We got waves of seniors we have waves of seniors at what some experts are saying has a potential to double the amount of shopping and double the amount of enrollment activity compared to even last year, which also hit record numbers. And this is taking place because of many seniors are losing their jobs. We have clients with mixed preferences about meeting as usual. Maybe there's some adjustments, maybe not at all. So we are bringing you the first of two first-class enrollment platforms. It's the ultimate Ford versus Chevy or Pepsi versus Coke, but work with us and you get access to both of them. But then we developed And we brought together all of this in what we call a universal login. So all in one, simple sign-on process. You got multiple products, major carriers that are all on board with us, but I want to talk about Medicare supplements because we know that you have clients where Medicare supplement, it may be a good fit. MedicareCENTER doesn't want to overlook the power of Medicare supplements during AEP. So we've included a supplemental quoting feature. You can quickly and easily quote based on a number of key factors to help find the right plans for your clients. And it's all based on industry-leading quote resources. Having all these quoting enrollment features in MedicareCENTER means you have access to the quoting and enrollment systems for all the major carriers in one place, under one roof, one username, one password. And remember, you can access them anytime, anywhere, and really any device that you prefer. So keep in mind, we are so grateful that you've chosen to work with us. We want to be here to serve you. We're here to support you. Continue to keep your eyes open to updates as we prepare. New features come out, new carriers become available on the platforms. We've also adding a lot of material to our learning center. And if there's something you're not seeing, let us know. This is built by agents for agents. And if you have questions or additional training requests, please don't hesitate to reach out to our team. And you can also reach out to a specific and dedicated team that MedicareCENTER has stood up. These are individuals that know the tools inside and out, front to back. You know, we sit on the advisory councils for the back end support of these tools, but we're here and dedicated with our marketers to help support you, the producers, help you access all the products and all the solutions of your choice and make this the best AEP any of us have ever seen.
Alrighty, thank you, Stephen, for that introduction there. So what we're first going to look at is Medicare app. Medicare app is the previous MedicareCENTER. So for everyone that has previously used MedicareCENTER, this is the new MedicareCENTER, which is now labeled as Medicare app. So we get logged in here. First and foremost, we're going to have the availability to search for any beneficiaries that we've previously added to the site here. Pretty straightforward. You can use any of these details or information to search any profiles. Up top, you're also going to see if you can click plans, you can jump to the plan section, and therefore we'll be able to check out all of the plans listed based upon a zip code that we put in here. So quickly going through that, you would want to select the county after that, and then we can shop for plans. Once we do that, obviously we can see all of the details for the plans in the system. Simply, we're only seeing FlexCare, a false carrier, a made-up carrier for the sake of the presentation today. But that is how you would simply just jump the plans. Again, going back, if you want to go back to where we were to search for any of the beneficiaries, you could simply do that. Up top, you're going to have your contact information and your login credentials here as well. And to create a new profile, which we are going to do today momentarily, you would simply just click New Profile, and that's the process we'll go through today. Down at the bottom here, we do have the same availability that we used to have. So the links that used to exist under the resources section will still exist. You're still going to have access to the drug, pharmacy, and doctor lookup. So you're still going to have all of that information and resources down here at the bottom. Another link that you're used to seeing that we will continue to offer is the enrollment status and opportunities, which allows all agents to find their book of business within the system. So you're still going to have the availability to access all clients and consumers that you've added to the tool. Additional to that, we've implemented the benefits eligibility. We've offered or implemented, I should say, the benefits eligibility checker here. So really cool stuff. This is not really for enrollment purposes, but it does serve as a really nice added benefit for your consumers to kind of help them through that process and see if they qualify for any additional help there. So that's new this year. Going back here to Medicare app, we're going to go ahead and get started with creating a new profile. A very simple, streamlined process here. As we go throughout the system. For those who did use the system in the past, again, a completely new user interface, which is much easier here, as you see, to go forward with. So I'm just going to go through here. And make a test account for us. As we type this information here, you can see on the right-hand section, you're going to see something there where you can add notes and tasks. So notes is anything that you want to notate in the account, follow up, or kind of track throughout the process. Tasks is a really nice kind of CRM offering where it can schedule tasks for you, or you can schedule tasks for yourself, I should say, and you can follow through with that information as you need. So we'll add that just here momentarily. But after we create the profile, if there's a different contact, you would just click yes and fill out that information. We will not today for the sake of the demonstration today. Additional information here, we can add this as we have it. I'm going to go ahead and save the information because I want to show, once you save a profile and you go back to the profile, you'll always be able to access the quote history and the enrollment history that you've done with this consumer. As mentioned, you can go up here to the notes section and click add note, and let's just say Justin is going out of town next week. You can add the note, and then you're going to see the notes kind of pile up here as well. It'll say exactly who did it and the date it was created. Even better for the task section, we can schedule a due date. So let's say we want to go a week out and say, call Justin regarding his plan. Add the task, and as you see, the task will show up here on the right-hand side with a due date and a checkbox. Once you check that box there, which we won't because I want it to continue to display there, you'll be able to see exactly when you completed that task and move forward with creating another one if you need to do so. Going down here at the bottom here, we're going to continue through, and we can either add preferences or continue to the SOA. I ideally like to add preferences first, so we're going to go ahead and click add preferences, which is going to allow us to do the consumer's information, including their drugs. So the zip code populates as we just put in. You can put what coverage you're interested in if you choose. I'm just going to continue through. Health, this is primarily and only used to calculate your total estimated cost. It's not going to affect the premium in any way, shape, or form. This is just an ideal way to gather or calculate a potential estimated cost. Continuing through. Prescriptions. So if we know the prescriptions list here, we can go ahead and start to type some of those in the system. We do have the smart search functionality. So as you start to search for those drugs, it does populate the name of the drug, which you can find and click. You go ahead and put the dose and quantity, add the drug, and you see our drug cabinet start to build up here. Additional this year for Medicare app, we're excited to announce that we have integrated the Medicare Blue button, which directly connects mymedicare.gov with the prescriptions that they have maybe previously input there. So this is good for consumers that have previously created an account on medicare.gov, and that would therefore allow them to sync the drugs. Process is very simple. You would just send the email to the email that they use to register for medicare.gov. They receive an email which they basically just attest to saying this is okay. Once that happens, their drugs will flow from medicare.gov directly into Medicare app. So exciting news if there's a consumer that has that record created previously on medicare.gov, we can go ahead and hook those up into the system without having to retype all of those drugs. Let's just say we have one prescription here for this consumer, and we're going to continue through the process. As we continue through the process, we make our selected pharmacy here. You can see your pharmacy added up top and continue through. Once we continue through, you're going to see where it's going to bring us next here to the plans page. Now keep in mind, we obviously need to collect the scope of appointment, if you're going to be meeting with the consumer here. So a couple of different ways you can do this. Again, you can go back to your search. You can go ahead and go through the process of quoting if you choose to do that as well. But let's go say we want to collect the scope of appointment. So just to jump around a little bit here, I want to show you the search functionality. So if we wanted to search for any functionality here, let's just say we wanted to search for the profile that I created. Search for the profile, and you'll see how easily the system flows here. As you see, the profile populates here. You can click the name of the consumer to get into that record. Once we get into that record, again, everything remains. So showing you how streamlined it is if you want to research your profiles and add stuff, remove stuff, it's that simple. But let's continue to the SOA now. So as we go through the process, we're looking to collect the scope of appointment. It says up here, if you've collected a scope previously, you can upload a paper scope if you chose to do that. But down here at the bottom, we have a couple of different ways to collect the electronic scope this year. Previously, we've only been able to use the email address. We are very excited, as Stephen touched base on, to offer text enroll. So Medicare app now offers text to enroll. Phone number listed here, that's the one we put in the profile. Let's just say we texted the SOA to the consumer. It's very easily done. You would simply just click text SOA. You'll see that the text was sent to said number here. I'm using that as the example. So I just received a text in a very quick turnaround that says, complete your scope of appointment from Medicare app with a hyperlink. So at this point, the consumer would click the hyperlink, follow the steps to complete the scope of appointment, and they can sign digitally with their finger from their phone. So very exciting stuff there. They can collect the scope. Once we did that, we have a firewall set up in place, so we're not going to go through that process. The completed scope of appointment would show up here, and then therefore you'd be able to print or save that scope as a PDF if you chose to do such as well. Now let's go through continuing to plans. And now we have the availability to compare up to 3 plans if we chose to do such. Let's just say we were face-to-face with the consumer or we wanted to utilize the new text to enroll functionality. So previously you would simply just, if you wanted to send a quote, you could compare up to 3 of these plans. Then you could add to quote, send it to the consumer to review. Once the consumer reviews, they would follow the steps to go through the process and enroll themselves. But we really want to show you the new feature here and the one that's going to save the most time and benefit us the most as we move forward with this day and age and the kind of the environment we're living in. So let's go ahead and focus on that. Let's say that Justin Test here, our consumer for today's demo, was comfortable in enrolling in the FlexCare MAPD Plan 1. To see more plan details, it's very simple. You would just click View Plan Details. Once it pulls up the plan details, it's very nicely laid out for you to go and review with the consumer. Your prescriptions are up here, so if you added prescriptions, you can simply just click that. You'll see the breakdown. You can see the gap and donut hole and all of that fun stuff with total cost. But going back to plan details, everything here listed out is everything you need to review with the consumer. Additional to that, the system is 100% compliant. This gives the consumer everything you need to remain compliant. It gives them the summary of benefits. It gives them star ratings. Everything that you're required to provide to the consumer is all listed right here. Let's say again that we wanted to enroll this consumer. You would simply just click Add to Cart. Once we add it to the cart, if there's options for additional coverage, you can simply click those. But we're going to skip that and continue to apply. Once we continue to apply, after 10:15, we would simply just go through the enrollment form, which is a very streamlined process. You would just simply go through there as you have in the past if you've used the system. If not, it is a very straightforward enrollment form. You would just, the information that you put in the profile does carry over, so it saves you time there. And then once you get to the end of the enrollment form, gathering the basic information you normally would for a paper enrollment, you have the option to text to sign as well. So simply, just like we just displayed for the text to collect the SOA, the same process exists exactly for the enrollment form. So if you chose to do that, or again, if you're face-to-face with the consumer, you do have the option or availability to do that and have the consumer physically sign when you're face-to-face. So pretty good stuff for Medicare app. We're very excited for the changes, the new user interface to give everyone here to use this AEP. Now we're going to jump over to show you Sunfire. So Sunfire is Medicare Link. If you're Connecture versus Sunfire, Connecture is Medicare app. We have Sunfire who powers Medicare Link. So jumping over here to Medicare Link, we get through the login page, and as we get here, Stephen touched base with a lot of these things really quickly, but we're going to go through kind of a brief demo just as we did for Medicare app. So we get logged in here. As you see, you can see your prospects for the last 30 days. You can see the enrollments for the last 30 days, how many are successful versus incomplete, and get those done as well. Resources, messages will all show here as well. And up top, even to the right, these buttons are similar to these links. The links are exactly what you'll see over here. So if you wanted to search for your prospects, quote and enroll, send a scope, reporting, etc., you would simply access that information from this front site here. But let's say we wanted to go ahead and create a new profile just as we did for Medicare app. Again, these buttons over here are going to be dashboard, customers, quote, scope of appointment, and reporting. If we wanted to go to the dashboard and click any of this information, we would just simply do such. But we are going to, I apologize for the delay here. It is a testing site, so we sometimes will experience some issues, but promising that this will not happen during the live dates here. Promise as much as we can. Give it a second here. We're going to create a new account. Let's just say we want to send a scope here. Let's see if this is going to work for us. Okay. So we made some movement here. I do want to go back here to the customers page. Here we go. So now we're moving. So we're going to create a new profile. Simply, as we just did, you are going to type the zip code and moving along with basic information. As we create that information, we can click save and quote, or we can simply just save. Let's again just save, because what's going to happen is we save the profile, and as you see, we're now working with said profile you just did. You can also clear the information, find a new consumer by clicking that piece of paper. You can change their status. So if you can look through these this criteria, you can simply follow that process. And let's say we sent the scope, which we haven't, but we're about to. And we just say sent scope. You can save that information. Now let's go look for the profile that we did. And there it is. So here's the information. It's very simple to find. Over here, the disposition will be here, but let's go back to our actions. Now we can go edit the profile, start a quote, send a personalized URL, or collect the scope of appointment. Let's go ahead and collect the scope of appointment at this point. Again, similar to Medicare app, Medicare Link offers text scope. So let's go ahead and click text scope. And you're going to see the scope of appointment populate here. I'm going to just select some information, make some information up here. And let's say we completed the scope today. Scrolling down, and then we can click text. So at this point, I used, again, my phone number here. So I just received the text already. And very similar to Medicare app, they're going to send it, you're going to have that code. So as the agent, you have to provide that code to the consumer. So I get the text that says, "Dear Justin, please click the link below to electronically sign the scope of appointment form." I simply click that scope of appointment form link. And at this point, I need that personal code. So agent gives that code to the consumer. So I have it right in front of me, continuing through, and I see the scope. Very easily done. I go down and I hit save. Once I sign here, by typing my name and hit save. Once I save as the consumer, you're going to see how quickly that comes. They're going to get a nice little thank you prompt that says, "Thank you for completing the scope of appointment." I'm the agent again, so I go back and refresh my scope of appointments, and now you're going to see the date it was sent, the date it was signed, and you can now view it as well. I now need to sign it myself as the agent by simply just clicking that blue hyperlink, and now you see how easy it is to be signed. We have now successfully completed the scope of appointment, and we could go back and start quoting and build our consumer's profile again. So if we wanted to jump to the quote by simply just doing such here, we would do that. But let's again show you how to edit some things on the profile. So we go to edit profile, and then again, you can just add anything, the criteria here, and then you can hit save and quote, and all of the information begins to populate as you see. So any of this information, again, very simple and straightforward, just as Medicare app is. We're going to go ahead and just put some generic information in the fields and continue through. At this point, we now have the option to search for all of these drugs. We can go over here and add medications up top here. So let's again add Montelukast and add the dosage and the quantity. And now we start building the drugs for the consumer at this point. So as you see over here, again, we can go to the health questions and kind of see that information over here. And same with doctors. So Medicare Link has the advantage here when you can do shop by doc. So what that means is essentially you can search for any of these zip codes and you can find specific physicians. And of course, we know there's going to be a Smith here somewhere. So I'm going to search for Smith and let's say John Smith here. Continue through. You can add any of these doctors. And now you're going to see your doctors list pile up over here. It at that point filters down to the plans that that specific PCP or doctor offers. So we now can filter more plan types by carriers, by premiums, by policy types, etc. So similar to Medicare app, you can complete or compare up to 3 of these plans if you chose to email to the consumer. But very similar to Medicare app, we want to display the new feature here with text to enroll. So simply, let's just say we can compare up to 3 of these, again, as promised, and then you can compare or email. If you wanted to, again, send it to the consumer and email, that's how you would do that. But let's just say we wanted to enroll in the United Healthcare HMO plan up here. We could simply just click enroll. So I'm consumer on the phone or face-to-face, and I would simply just start to begin the application process here. Going through the application process is very similar here. We will get hung up on the Medicare ID number, but let's just quickly show you what the application looks like, simply because it does look very similar on Medicare app as well. So again, we can just complete all of this information. Email address, residential address, and continue through. At this point, again, you would put the information here, go through the process, continue through, and after the next 2 pages of the additional questions that always exist on paper versus enrollment forms, such as ESRD, drug coverage, etc., do you work? Once you answer those questions, you get to the final page of the confirmation in which you would collect the signature, and that can be done just as we did for Medicare Link's scope of appointment process as well. Very easy process. You can either text to enroll, you can be face-to-face, or this can be done remotely via the consumer's completion of the enrollment form as well. So without further ado, let's just say we went through that whole enrollment form. We got everything done. We want to go back to our dashboard, and now we are back to where we started, additional with the completion of the enrollment and all of the fun things here listed in the profile. So again, you can quickly see how we go through the process and systems for both Medicare App and Medicare Link. And it is a very, very easy system to use. We're super excited at Integrity Marketing Group to be able to offer you MedicareCENTER. MedicareCENTER is going to be the one-stop shop for anything that we want to offer for our agents, have the accessibility at your fingertips, especially this AEP. We worked really hard to have this available for this AEP. So as you go through the process, we really strongly recommend, if you feel that there's some things that will help you get you through AEP, help in the future processes, we strongly recommend you bring those recommendations to us. We really appreciate all of your business and your efforts that you do for us. So we want to kind of give that back to you all. So again, thank you all so much for your time today. We are very excited here to get rolling on AEP. And again, thank you so much for your time.